I had Waiting Isn't an Option, How to Survive Advanced HIV. So HIV stands for Human Immunodeficiency Virus, and that's when it interferes with the body's ability to fight any infection and diseases. And there's a couple stages to HIV. The first stage would be the acute primary infection. You may feel like you're having the flu or any flu-like symptoms. Stage 2 is asymptomatic stage, and that can last for about 10 years or so, and you won't have any symptoms. And then stage 3 is symptomatic HIV virus. This is when the immune system has been so badly damaged and it can't fight any infections or diseases, which is also known as advanced HIV, which is also known as AIDS. AIDS is the advanced HIV when it is left untreated. This is when your T cells drop below 200 and your immune system has no way of fighting any infection. This is the stage 3 of the HIV infection. When a person doesn't receive any treatments, they have about 3 years or less to live. The main cause of death is people fail to take their medications, receive treatment. People don't go and get diagnosed, which leads to delayed treatment, which can be a cause of their death. Waiting isn't an option. With advances in medicine and technology over the last couple of decades, people with HIV and AIDS can live a long life, but many people are still dying from advanced HIV. In 1996, the total life expectancy for an infected person was about 39 years, but then in 2011 it increased to about 70 years old. A person with HIV positive can still live a healthy lifestyle if they continue their treatment, and it's a lifelong disease, so they must continue their ART treatment, and they can live until their 70s. Death due to AIDS and HIV decreased by 63% over the past 20 years. People who have HIV or advanced HIV will have to be on a regimen of antiretroviral therapy, and that consists of cocktail of drugs, which are 3 or more anti-HIV drugs. Treatment as prevention is a strategy that is used to promote constant and consistent treatment, and it helps reduce the spread and transmission of HIV. And an earlier diagnosis leads to earlier treatment, which is needed to live a healthy lifestyle. Why treatment is delayed? Certain people don't have the knowledge about HIV and how it's transmitted. Although more people are learning about it, many people still don't get tested and still lack HIV knowledge, which without the knowledge, they don't get checked, and that leads them to AIDS. A lot of religion and churches are against the antiretroviral therapy and are influencing people not to take the medications, and also the cost of the medications in the hospital plays a big part of it too. Prevention, one way to prevent the transmission is to educate patients early on. Make sure they know that how it's transmitted. It can be transmitted through syringe use, blood, bodily fluids, unprotected sexual contact, from mother to baby as well. And educate people to get tested if they are at risk, and when they're tested earlier, they can get diagnosed earlier to have treatment. They also use CD4 monitoring, and this is used to watch the T cells and prevent them from dropping below 200 and prevent the HIV from advancing. And these are my references.